Welcome, everyone. We're very happy to do this special webinar on deliberate practice in dialectical behavior therapy. My name is Alex Vash. I am with my wonderful friend and colleague, Tony Rumener, and we have the wonderful luxury of having two DBT experts with us today, Tali Boritz and Shelley McMahon, who are also co-authors of the new deliberate practice in dialectical behavior therapy book, which we'll be focusing on today. And this is published by the American Psychological Association. Tony, you want to give just a brief presentation?
Yeah, briefly, Alex and I are with the Sentio Counseling Center. We provide online therapy at very low fee sliding scale rates for teens, couples, and adults in California. So please consider us for your referrals. We also do advanced supervisor training in deliberate practice. So if you're interested in that, please check out our website there on the screen. Thank you.
Great. All right, so as I mentioned, our guest experts for today are Tali Boritz and Shelley McMahon. Let me just provide some brief presentation on both of them. So Tali is an assistant professor in the clinical psychology program in the Department of Psychology of York University in Canada, and a collaborator scientist in the Borderline Personality Disorder Clinic at the Center for Addiction and Mental Health in Toronto, Canada. She specializes in the treatment of borderline personality disorder and complex trauma, and she has also done research on the treatment process and outcome and psychotherapy training for borderline personality disorder. Shelley McMahon is an author, researcher, and associate professor in the Department of Psychiatry at the University of Toronto. She's a recognized leader in dialectical behavior therapy in Canada and internationally. She is the head of the Borderline Personality Disorder Clinic and the co-founder of the Center for Mind-Body Health in Toronto. She currently serves on the DBT Strategic Planning Committee and on the Scientific Advisory Board of the Linehan Institute. And we are very happy to have both of them here. Thank you so much, Tali and Shelley, for joining us today.
Thanks, Alex.
All right, so let's jump right in. So this is the single slide telling you basically why we're all here. This is the only real, I would say, conceptual thing that we want to get across. If there's one idea we want to get across today, besides anything DBT specific. Yeah. So after years of learning research, psychotherapy training research, we really have honed in on this important distinction between conceptual learning and procedural learning. Conceptual learning is all the things that you know and learn through reading, through reflecting, through attending lectures, like this one. So anything that has to do with reflecting and conceptualizing skills. And those are, of course, super important. And what we have found is that the bulk of our training as clinicians, as social workers, as psychotherapists, often focuses on conceptual learning methods. So think back on your training experiences. Most of them would probably fit in the box of conceptual learning, learning about theories, learning about models, discussing cases. All of that would be conceptual. Now that's all fine and good, very important, but what's often missing in most training programs, be it beginning training programs, graduate programs, workshops, advanced psychotherapy trainings, is what may be called procedural learning. What could be called in less jargony ways, learning by doing. So the comparison I like to do, you can see I have a lot of musical instruments behind me. It's the difference between learning about the piano through reading the history of the piano on a book and actually playing the piano, actually having to touch the piano in order to understand and be able to play a scale, a musical scale on the piano. What we've often found is that most psychotherapy training either does not have at all procedural learning, or when it does has it has it in a slightly unstructured, unsystematic fashion. So our team and others have been trying to basically fill in this gap in the field by contributing with procedural learning resources to go along with the conceptual learning that most people do. So instead of just reading, for example, about DBT theory, DBT techniques, then you can also do skill building exercises in order to hone in on actually being able to do those skills with actual clients. So this is what we've been doing for the past few years. It has led to a book series published by the American Psychological Association. Each of these books focuses on a specific therapy model, and each of these books has 12 skill building exercises, procedural learning exercises, where you can practice repeatedly a skill and get better at it over time. So it's not just thinking about a skill and discussing a skill, it's actually through role playing, getting better, actually doing the skill with real clients. And as you can see here on the left, our wonderful guests for today, Tali and Shelley, have led the charge in creating this book, on publishing the book of deliberate practice in dialectical behavior therapy. So their task really was to take the very rich theory of DBT and be able to pick 12 skills that would be amenable to create skill building exercises that people could go into the book and use in order to consolidate their skills. And this is what they came up with. So here is a table of contents. Now, of course, we know that through doing these 12 skills, no one is going to become an expert DBT therapist. The idea is not to be a comprehensive skills manual, but it is a really good starting point for those of you who feel fairly confident in the theory of DBT, but once you get to an actual clinical session, you might not feel as confident, which I don't know if you've ever felt that way. I definitely have felt that very often. And this 12 skills that you can see here, and we'll go over them in a bit, can target one skill at a time, something that you can practice from the DBT toolkit, let's say. So I'm going to throw a question off to our guests, Shelley and Tali. And before jumping into the specific skills focused on this book, I would like to get their input on basically what does DP, deliberate practice, add to DBT training? Shelley and Tali, I know which of you would like to start, but if you could just talk a little bit about the applications of deliberate practice for DBT.
I can take the lead on this, Tali, and feel free to jump in. I think that there's many things that deliberate practice adds. I think, first off, most of you know that DBT was explicitly designed for people who are usually struggling with more complex problems. And I think one of the real benefits of deliberate practice is that it allows people to rehearse and really learn some foundational skills in response to a variety of situations. And as a DBT practitioner working with complex people, you need to be able to learn to modulate your own emotions and to be flexible and to be responsive to a range of situations. And I think many of the exercises in the deliberate practice approach provide opportunity for a range of situations, scenarios that people would struggle with, and that also often evoke our own emotional reactions. Maybe pause there. I could say more, but I'll let Tali jump in if she has anything to add.
Well, just to piggyback on what you're saying, I mean, it's an opportunity to practice outside of a very, what can be a very stressful, chaotic, sometimes emotionally dysregulating moment for therapists themselves. So it's an opportunity to really learn this so that you're prepared when you're in these high stress situations. But DP is also very consistent with the DBT model, because in DBT, we're constantly asking our clients to deliberately practice the use of skills in session, outside of session, so that they can be prepared for moments of crisis when they hit. So in a way, it's a nice, there's a nice synergy between what we ask our clients to do in DBT and what we're trying to do with our trainees who are starting to learn DBT. I really like the mirroring of that.
It's kind of a practicing what you preach kind of thing, using the deliberate practice for DBT training. Great.
Exactly.
So what has been your process in choosing the skills for this book? I remember, when we started these conversations in doing a book on deliberate practice for dialectical behavior therapy, we knew we couldn't possibly have all skills from the model in this book. And it was hard enough to create these exercises, right, for people to practice. What was your experience in choosing these particular 12 skills? I'm going to put them up on the screen just for a bit again. these particular 12 skills. And I'll just point out that you'll see it, there are these kind of lines here, green, yellow, and red. And that speaks to the level of difficulty that we were able to assess in a kind of subjective fashion, but we also did a lot of testing across the world. And we start off with what you could call more basic skills that you can practice, and then more intermediate, harder skills. And by the end, you're really doing skills that have a lot of different components to them. But maybe, Tali, could you speak a bit to this choice of skills for this book?
Sure, I can start with this one. When we were thinking about which skills to include, we went back to the basics of DBT theory. When we think about DBT, we can separate skills into acceptance skills, change skills, and dialectical skills. And really that's what constitute how we practice DBT. So when we talk about acceptance skills, we're talking about skills that really encourage, help our clients accept how they're feeling in the moment, accept situations they can't change, lean into their emotional experience rather than avoid or escape. Change strategies help clients actually use skills to change their experience, to change the way that they're responding to any given situation. And dialectical skills are really what help us to be including both of those sets of skills in any given moment, or when it is appropriate with a particular client in a particular moment of therapy. So we were really thinking along the lines of how to teach people acceptance skills, how to teach people change skills, and how to help people partner those skills or marry those skills so that they can use them flexibly with their clients. So that was really part of what we were thinking about. But we were also thinking about how to use skills that help people structure the therapy. Oops, sorry, my phone is talking to me and I'm not sure why. How to structure therapy in a way that we can actually help people learn how to do DBT. So I think those were sort of what we were thinking about when we looked at these skills. And then we were also thinking about skills that were foundational to formulating, actually helping trainees formulate DBT through the development of specific skills. So for example, how do we get people to think out loud about emotion dysregulation as the core dysfunction underlying problematic behaviors? How do we help people articulate that to clients? How do we help people articulate the idea that problematic behaviors often are an escape or avoidance strategy from aversive emotion? And then how do we help people think about ways to solve that problem, not escaping aversive emotion? So we were really thinking not just about sort of therapy itself, but formulation, and how do we begin helping trainees formulate the problem to their clients as a way of beginning to learn the therapy. Sorry, that was a very long-winded answer, Shelley. I'm not sure if there's anything you want to add there.
There's not a lot I can add because I think you've, summarized things well. I mean, perhaps just to add, you only gave us 12 skills that we could select from. So it was really hard to whittle it down, but I think we did want to capture core skills as well as strategies from handling some very challenging situations. So suicidal behavior often is, when clients present with suicidal behavior, that can often be very dysregulating. It can people can respond in ways that are not so helpful, and they don't know how to respond effectively in those moments. So hence we wanted to include a skill that would directly address how do you respond to clients who are suicidal, as well as a skill for addressing clients who present in an highly emotionally distressed state, because I think those types of situations are often really challenging for people.
Yeah. One thing that came up, so like I mentioned before, this book series and this book in particular, we don't just write up, or in this case, Tali and Shelley don't just write up these deliberate practice exercises and they're set in stone and we publish the book. We actually do multiple rounds of testing where we sent out drafts of the exercise to different people all over the world, and the testers have to video record themselves doing the exercise, send us back the recording, we review the recording, and we do appropriate revisions to the exercise from that. And I mentioned this because one thing that came up interestingly in doing these testings is not just that the people testing it had very helpful feedback to revise the exercise, they felt they were getting better at the skill over time, but interestingly, doing the procedural skill, they would say in their written feedback, helped them better understand DBT theory. So this is something we didn't initially expect, is that one of the best ways to learn theory is through skill building exercises. And I'd be curious to know maybe you have a radical behaviorist perspective on this, on why that would be. I'm kind of curious what's your take on that.
I mean, I'm not surprised, because what we're trying to do in the development of these skills is to help people respond, to be responsive and to be more precise in the way that they're responding. And so I think for those who are familiar with the book, or who will become familiar with the book, there is a logic that follows through the development of these skills. They all build on each other. And they all tie back in. I mean, in a way, they all tie back into the core premise of DBT. And so if you don't, if you're coming in with a conceptual understanding of DBT, but you're getting feedback that you're kind of missing the mark, or the precision is off, or you're missing the, again, sort of like the core problem that's being presented by the client, I think it does sharpen your formulation. It sharpens your conceptual understanding of what the problem is that you're trying to address. So something that we were trying to constantly do is direct people away from focusing on content and instead focusing on process. What's the emotional process that's happening with each client? You see that in every single skill throughout the book. And in doing so, I think it reinforces the idea that affect and emotion is essential in DBT. Understanding how people escape emotion is essential in DBT. So whether you're practicing the skill of validation or you're practicing the skill of informal exposure to emotion, we keep coming back to this idea over and over again. And I do think it sharpens the conceptual understanding of what's going on with clients who are presenting with emotion dysregulation for dialectical behavior therapy.
And if I can just add to that, maybe, in part, I'm actually almost surprised that perhaps other people haven't made those comments on other books, because I would assume that would be true of deliberate practice, regardless of the approach that you're using, since the whole process really involves not only the practice, but an important part is being able to pay attention, to try and attend to what you think is relevant information, and to get feedback on what you're attending to. And so, I think, as Tully's saying, through that process, it shapes up what you are attending to, what you may decide in a particular moment might be really important, and what might be information that may be less important to attend to. And I think through that, it helps you understand theoretically how DBT conceptualizes, people's struggles and how to change it. Yeah.
Can I just speak to that briefly? Yeah. So, I mean, one way that, your book is kind of different than the other books in the series is you're really helping, or DBT is really helping therapists help clients who are often at a higher state of emotional arousal. They're more activated, they can get more activated quicker. And when they get activated, they can more quickly go to behaviors, to comments that can be more alarming for a therapist, notably, suicidal ideation and stuff like that. And so I think something we're hearing from people who are using the book is that, they kind of understood the DBT theory and all that, but when they're doing the exercise, they experience some of that emotional activation. And then, it's one thing to understand the theory. It's another thing to then feel it help, and then all of a sudden it's like, whoa, this is like experiential based awareness, right? It's almost like
you're saying that the book is like an exposure exercise in and of itself.
There you go.
I think it is, actually. I think I think often that's what experienced clinicians have, is often the history of being exposed so many times to various scenarios, different scenarios, that you can modulate your own emotions much easier, and then move in a way that's effective and be responsive to people.
Yeah.
Great. I mean, I think this is a perfect segue to give people a taste of the actual exercises, how we actually do the lower practice exercise. So Shelley and Tali, you chose for today to give people a taste exercise number 10, which is coaching clients in distress. And maybe I'll just ask you briefly, could you explain for our attendees what this exercise is? We can go into the skill criteria in a minute. I know there's a particular piece of jargon that some people might not be familiar with about this skill, which is the TIP skills, I believe it's called. You want to say a bit about this exercise?
Shelley, do you want to say something about this, or you want me to?
Oh, you're muted, Shelley. Shelley, you're muted.
I will say nothing. Okay, maybe I can say a little bit about the overarching skill itself, and Tully, if you want to maybe comment on the skill part, the tip part. But in a way, this particular skill was based loosely on a skill put together by Charlie Swenson, which was referred to as an AVIS-R protocol. And the idea was when people are in a state of emotional crisis, often what can get missed is from therapists being able to be fully present with the client, being able to listen to the person non-judgmentally, to be able to validate the person in a state of distress as a really important initial first step. Then moving from validation to trying to assess whether the person's motivated. And what we've highlighted in this skill is first the importance of validation and the importance of weaving in an attempt to get the client motivated to change their behavior. And only when you've got a client who's actually motivated, willing, they actually shake their head and say, yes, okay, I'm willing to do something different, would you then explicitly direct them on a specific skill? And the skill we chose to present in this particular skill is the tip skill. Tully, I don't know if you want to add something about the tip skill.
Well, so we chose to introduce, I mean, so for those familiar with DBT, you'll know that there are many, many different skills that we would be using when you're coaching a client who's in distress. But often the distress tolerance skills in DBT are the ones that we go to when a person's in high distress. It's how to get people through a crisis without making it worse, essentially. And the tip skills are a set of skills that we use to help interrupt heightened states of emotional arousal by really intervening with the body or intervening at the level of physiology. And so the TIP skills stand for temperature, intense exercise, paced breathing, and paired muscle relaxation. And we really just present a brief snapshot of what each of these pieces are. And our intention isn't to teach the DBT skills in totality in this skill, but rather to help people who are learning DBT get practice in offering, inviting a client or instructing a client of a skill that they can go to when they're in a state of high distress to downregulate their emotion so that they can engage in problem solving, or so that they can return back to the therapy session, so that they can help the client out of that immediate crisis moment. So the TIP skills are one set of skills. We do present other distress tolerance skills in another skill in the book. We talk about the STOP skills and some mindfulness skills. So there are other skills that are introduced in the book, but DBT does have many other skills that we didn't get a chance to present.
Great. So in this particular exercise, so for all the exercises, all of the lower practice exercises in this book and all the other books in this series, we break down the exercise into what we call skill criteria, which is often one of the hardest part of designing these exercises, is translating a broad skill, a broad therapeutic technique into very concrete therapist behaviors, right? So the two skill criteria, which are the two therapist behaviors that define the skill, is for the therapist to start by validating the client's affect and or the difficulty of tolerating affect, and then invite or instruct the client to use a distress tolerance tip skill, be it the temperature, intensive exercise, paced breathing, or paired muscle relaxation, to reduce the intensity of emotional distress. as a side note, I particularly like this exercise because it really shows the balance between acceptance and change. It's very dialectical exercise right here. The first criterion being much on the acceptance end, second criteria much on promoting the change. So let's see an example here. For all the exercises, we have 15 client prompts, pre-scripted client prompts. So one person will be reading the client prompt, and the therapist has to improvise a response that would meet these two criteria. So as an example, let's imagine the client says, "I'm so angry at my boss, I just want to quit my job." Therapist could, for example, reply by saying, "Your anger is really intense, and your impulse is to do something abrupt, like quit work," which would meet the first criteria. They could then say, "I'm wondering if we could do some paced breathing together right now to bring your anger down, so we can then think together about whether quitting work is the most effective decision." And notice this meets criteria 2, invite or instruct the client to use a distress tolerance tip skill. So in order to do this skill correctly, all therapists' responses have to meet both criteria, validating and instructing the client on using a distress tolerance skill.
I wonder, Alex, if I can just make a brief comment here, because I realize that actually in our book, what we do is teach validation as one of the first sets of our beginner skills. And so we're here throwing you into the deep end and asking people to be practicing one of our more advanced skills, which requires practice in actually understanding what validation is. So I don't know if it would be helpful for us to say a couple sentences about what validation is in the context of DBT.
Sure.
Would that be helpful? I don't know, Shelley, if you want to introduce validation, I'm happy to.
Sure, but I can say, and it's a good point. We went right to the last, one of the later skills without thinking that you may not have the background for it. But in short, validation in DBT is where the therapist communicates and highlights what makes sense, what's reasonable, what's understandable. Really, what's the wisdom in an individual's response? It could be their emotions, how they're feeling that makes sense or that's reasonable. It could be the way they're acting, or it could be the way they're thinking about a situation. And so you'd want to highlight explicitly what it is that makes sense, what it is that's reasonable. What you would want to avoid doing is highlighting anything that doesn't make sense. Which would be validating what's not valid. Okay.
And yeah, well, and sometimes what gets confusing is that validation is used in many therapeutic models, and it's not always used in the same way that we use it in DBT. So Shelley gave a really nice definition of what validation is. Maybe what it's not is praise and reassurance, which sometimes people can get confused about, because in some ways that is how we use it in the regular parlance. We talk about validating people's feelings, but we're really looking for trying to highlight what's understandable, what makes sense about a person's experience.
I think we can also practice what we preach here. And as we go through the exercise together, I'm sure you, both Shelley and Tali, can provide feedback, and it will become even clearer as we go along. So what we're going to suggest now is for all of you wonderful attendees who would like to join us, you don't have to show up on the screen, talk out loud. We're going to invite every one of you who wants to write on the chat a therapist response that meets these two criteria for new client statements that are going to show up on the screen. So let me do that right now. So let's imagine we have as a client prompt, the client anxiously saying, "I feel like I'm having a panic attack. I can't breathe." Now let's give people a minute and feel free to write on the chat a therapist response that you think might meet the two criteria on the screen. And then Shelley and Tali will provide some feedback.
Okay, Tali and Shelley, I'm going to read these responses, okay? And I'll read them kind of slowly, So the first response is, "It sounds like you are experiencing trouble breathing. Could we do one of the tip skills together to see if we can reduce some of that panic feeling?"
Okay, so shall we? Well, you
Yes,
want us to
please.
comment right now? Yeah, yeah.
Yes, please.
Okay, so it looks like actually both of the criteria are met. There's both validation in the first statement, and there's also in the second statement an invitation rather than a command, inviting the person to engage in a skill to reduce their anxiety in the moment.
Great.
Now, if I may pause there, what I also noticed is that the person invited to use a broad tip skill, but didn't name a specific tip skill that could be used. Would that be part of your criteria? They would have to name a specific tip skill?
For the
Yeah.
purpose of this exercise, yes, we were asking people to identify a specific skill so that they could practice. In real life, I mean, depending on the client's familiarity and your familiarity with the client and what skills work, you know, it might look a little bit different. But yes, we wanted people to think about, is there a specific skill of the four that we've outlined that may be more appropriate or more effective?
Right.
But the truth is that any of these four can be used in coaching clients in distress. Oftentimes, it's not just one skill that's going to be effective.
Right. So it's really inviting trainees to practice being very concrete about the suggestion, right?
Yeah, and I mean, maybe if I were to strengthen this even further, I think getting very specific about what the client is going to practice, and maybe even very specific and perhaps even slightly more precise in the validation, because it may be more intense than difficulty breathing. You know, it almost sounds to me like this person thinks they're actually dying. They can't breathe. So really capturing and mirroring the intensity, validating the intensity of that fear and really terror almost.
Great. Let me read another response here. You're experiencing intense sensations that are causing you to have the thought that you cannot breathe. Would you be willing to try to change your temperature using ice as a way to shift your body out of this panic?
So I think the second part, the second criteria is really well met there. I think with the first part of the statement, there's a lot going on in that, in what's being said. There may be a little too much is being said. You might lose the client very quickly when you're referring to the thought that's making you think that you can't breathe. Instead, I think to be more precise and more pithy in the validation, you might just go to, you're feeling like you can't breathe. It's the reflecting what the client is saying, or anxiety. It makes sense that you can't breathe. Anxiety can sometimes interfere with breathing. Are you willing to then? So then moving into this, the invitation to use skills. So I would just sharpen up the validation a little bit.
Great. Here's another one. You're feeling really anxious and having trouble breathing. And I'm wondering if we can pause here and practice a skill that might help reduce the intensity of what you're feeling. What do you think?
I can see this written in the chat. I'm just trying to find it. But I think the first part is a nice example of validation. It sounds like you're experiencing trouble breathing. And so I think that's an accurate reflection. I think there's a nice invitation. I'm now missing where it was.
Oh, I'm sorry. It was sent as a direct message.
Oh,
so
okay.
Yeah.
Maybe give me the second part. There was something I wanted.
Oh yeah, let me read the second part. I'm wondering if we can pause here and practice a skill that might help reduce the intensity of what you're feeling. What do you think?
Okay, so that's a nice invitation. It's capturing an aspect of that criteria, which is the invitational aspect to use a broad skill. And, you know, probably the next step would be getting specific about what skill the client could use. But I really like the sort of invitational quality. It's not a command. Right.
Now, and this might be what make this exercise a bit more of an advanced exercise, is we're asking the therapist to kind of do multiple things, right? There's validation and pick a skill, and not just a skill, like a specific skill. Would you say this is, this is a recurring task for a DBT therapist to be thinking in the back of their mind, okay, what skill is coming up, right? Like what skill is going to help here? Would you agree with
Yeah,
that?
you want to be always sort of attuned to what the client might need in the moment.
Right.
You know, is there a deficit in how they're handling,
Right.
coping in the moment, and what skill might be most relevant?
Right.
In this situation, somebody who's really struggling with breathing because they're panicky, actually probably deep breathing might be especially useful.
Right. Yeah, this is something I think these exercises, deliberate practice, is particularly well suited to DBT, because in DBT, I mean, you're really kind of doing multiple things at once, right? You're kind of monitoring multiple gauges, if we were going to use a metaphor from a plane or a car. And in this exercise, you're really getting the therapist to kind of attend to the emotions and also a practical skill, kind of a judgment. Let me read another one here. It sounds like your anxiety is really high. Would you like to try the temperature skill to bring your anxiety down and help regulate your breathing?
Can you read that one more time, Tony?
Yeah. It sounds like your anxiety is really high. Would you like to try the temperature skill to bring your anxiety down and help regulate your breathing?
I think that's a good response. I mean, the validation is sort of reflecting the anxiety, that the client's anxiety is heightened, and then invites the client to use a specific skill, temperature, to bring the emotion down. I mean, I think that's a perfectly good response.
Great. Here's another one.
Maybe just add there, it does require the client to be aware of what the temperature skill is. So, and maybe they do, maybe they don't. So, they might not know what you're talking about. What is the temperature skill? So you might need to be more concrete, but that's where, you're assessing, what do you know of this client in the moment? Are they familiar with this?
That's context dependent.
Yeah, that's a great point, because actually, something we should probably mention about these skills is that when we're working in DBT model, we could be coaching clients that are, in distress in the weight room that we've never seen before. We don't know them, and we don't know what skills they know or don't know. Or we could be working in coaching clients that we've been working with for months. So we do want to be specific in how we're instructing or inviting clients to use skills. But of course, for the purposes of this demonstration, we appreciate you kind of putting in saying temperature. What a therapist might do if they're more familiar with DBT skills is say something like, can you put ice on your temples right now, to see if that can help bring the emotion down. So getting more specific in the use of that skill.
Because you're getting so much rich feedback, and this is the kind of magic of the word practice, is you can get in a lot of feedback, very concrete feedback, and also theory building as you're doing the rehearsal. So I'm going to suggest we move on to just a different client challenge here. Let's move on to maybe a fairly more intense one. So client says, I'm having really strong urges to self-harm. I've been fighting them all week, but they've just been getting stronger. Nothing else is helping, and I need some relief. Let's give people a moment, and feel free to, in the chat, suggest a response to this.
Okay, here, I just received one through direct message, so I'm going to read it to you, Shelley and Tally. Oh boy, that sounds really intense and scary. What do you think about practicing some paced breathing together, or some paired muscle relaxation strategies together?
So the second part, I mean, it sounds, first of all, there is a reflection that sounds scary, and maybe I'll comment on sort of what I thought went well about it, and then areas that you might tweak to strengthen it. So there is validating the fact that the person is maybe feeling really afraid and scared. And there's also, again, that invitation to try a skill. I can't remember now what skill it was. I've forgotten, I think, my talking, but I think if I were to strengthen that response, I would probably want to capture more specifically what the client's experience is in the validation. And maybe I might want to attend to the emotion that the client might be trying to relieve. So
Right.
we know that the client is
Right.
having urges to act
Right.
on self-harm urges, and theoretically we
Right.
assume that's probably driven by an underlying emotional problem. And
Right.
I might want to validate the emotions that aren't being expressed that the client's trying to get some relief for
Right.
through my validation.
Right. There's something that occurs to me that I'd like to highlight here, which is I think the participants in today's webinar, a lot of folks here have experience with DBT, that this isn't your first rodeo, so to speak. And so the responses we're getting in the chat are all pretty good. And because I noticed the comment, the feedback, Shelley and Tali, you're providing are more kind of like edge cases, like here's how to improve something, that would already work. Here's how to, bump it up a little.
Mm-hmm.
And I want to highlight that because, ostensibly the books, your book was written for grad students, who maybe have no experience to DBT. But what we're seeing is these exercises can be helpful, and you can get very rich, nuanced feedback, even for experienced DBT therapists. It's almost like across the career span. And this fits perfectly with the theory of deliberate practice, which is that we should engage in continual skill development just across our career, and it really doesn't end. And I'm just very happy to see a live example of your book being used in that way. Here's another one. So your urges to self-harm are getting stronger, and it sounds like you're feeling a little defeated. Could we try some breathing so that we might help you get through this moment?
This is a good response. I mean, I think I'm thinking about criteria 1 and criteria 2, and maybe something that I think we're focusing on is validating the emotion, but we are neglecting a bit the second part, the and or part. I don't know if Alex, if you can put up the criteria again, just so we can all see it. So validating the client's affect and or the difficulty of tolerating the affect. I think that one is a really important piece not to forget. You can do either, of course, but we have in this great example, a client who's having urges to self-harm, and they're getting stronger and they want some relief. And so some of the responses are focusing on the difficulty of feeling the urges or the intensity of the urges, but I think where it could be sharpened is also focusing on the relief, the desire to relieve the distress, to escape or avoid the distress. And in highlighting that and in linking the urges to that desire, it can strengthen the validation. And then it makes a little bit more sense, the rationale for using a skill instead of moving into the problem behavior of self-harm. So I think it's, again, I guess to Tony's point, there's nothing wrong with the response that's provided. It's just a way to strengthen it. Again, to kind of tie back into the conceptual understanding of what is the real problem here. Yeah.
We're running into our last 10 minutes of the webinar, so I'm going to keep reading. We've got a whole bunch of responses. I don't know if we're going to get through them all. I'm going to keep reading them, but if anyone has any just open-ended questions for Tali or Shelley, please put them in the chat as well. Kind of now's your chance to get your questions in. But here's another one. That sounds so hard. You've been in so much pain and feeling exhausted from fighting the urges. How about we try a freezer pack to see if we can get some relief?
Okay, again, so it's accurate validation, and it sounds like a validation of the difficulty of modulating distress and not going with the urges. And there's also nicely sort of this invitation to try a skill to decrease the intensity, I can't remember the wording, of distress in that situation. If you wanted to sharpen this, and there's nothing wrong with this, but the focus could be on the difficulty of modulating distress, and it could also bring the client's attention to the emotions that they're trying to get relief from. So the validation could be also focused on, yeah, you've got really strong urges and it's so hard to get relief from, I don't know, and this is where you're guessing because the client hasn't said what they're trying to get relief from, but it may be through what you imagine they're trying to get relief from. So this is where you're validating what's not expressed. You just want you want relief from just emotional pain, just, or whatever you imagine based on what you know of the client. And I think perhaps to Tully's point, either one of those is totally appropriate. Helping the client be mindful of what their actual problem is can also be very beneficial. If they recognize, maybe it's pain or sadness or whatever they're trying to get relief from, that can help them then move towards their goals a bit more effectively.
Thank you, Shelley. Can I raise one more point here, which is, one of the more common concerns about deliberate practice that we hear is, oh, deliberate practice is just going to turn my trainees into robots and they're just going to memorize something and repeat it again and again. And, today is just a great demonstration of how deliberate practice is actually the exact opposite, which is every response has been different. It's been unique. There's infinite unique responses to this client statement. And really what you see here is therapists are kind of experimenting, stretching. They get an opportunity, a low stakes opportunity, because there is not a real client in front of them, to explore their personal style and to see, like as Shelley just said, what's it like to go a little beyond and, kind of hypothesize a bit, what's going on in the client, or what's it like to, do this or do that, and then get feedback from an expert. So I'm really delighted to see this. Here's another response. Anyone in your place would want relief from such strong emotions. You're doing the best you can with what you know. Can I help you practice other ways, like trying to reduce the intensity using the intense exercises skill?
So I really liked the opening statement. Anyone in your place would want relief from such intense emotions. I mean, I think that's a really nice normalizing response. And it's true. When people are in a lot of distress, it does make sense that they want relief. The second part, you're doing the best you can with what you know, that sort of steps out of validation and is kind of moving into something else, maybe a little bit more of reassurance. So I would probably take that out, at least for the purposes of this exercise. I'm not sure that would be the most helpful statement. But the next statement, can I help you practice other ways of reducing intense emotions? I added that in, although you do address that a little bit later, to try to reduce the intensity or to try to reduce the intensity of the emotion through intense exercise skills. I'm reading off the chat so I can see this. I think that's a really nice invitation because it also links the idea of we're going to use intense exercise to reduce the intensity of the emotion, which is what you're seeking relief from. It ties it together really nicely. So other than sort of that middle section, which veers more towards reassurance, which may or may not be effective, may or may not actually be the message you want to be communicating, since we might actually believe our clients can do something better in that moment and actually use a skill, which is something different. So I think that's how I would sharpen that response.
Tali and Shelley, do you notice that sometimes therapists can kind of, revert to reassure, like we can go to reassurance without even realizing it? You know what I mean? It's kind of like a habit or something.
We talk a lot in DBT about not fragilizing our clients, and by assuming, trying to take a therapeutic stance that towards our clients that they're more capable than they're as capable as anyone in being more skillful, and we're there to support them in that. But I think that that's an important principle, and sometimes reassurance has it has the impact of, in some ways, fragilizing our clients and saying they're there, it's okay, you're doing the best you can.
It's hard to tolerate seeing somebody in distress and in pain, for a lot of us. It's hard to watch that, it's hard to witness it. And, often we certainly don't want our clients leaving the session that way. We hope, here we are, therapists trying to help them. we hope they can reduce that. So sometimes the feeling is reassurance might reduce that.
And would you say that's part of like the spirit of DBT? Like there's a stance the therapist takes, and how can practicing these skills help a trainee or therapist kind of, you know, integrate and embody that?
I mean, I can comment that I think that really probably a key part for me in the deliberate practice is to be able to reflect on my own internal reactions in response to a range of clinical scenarios, because I think that often it's therapists' counter-therapeutic reactions, emotional reactions that can interfere with engaging more effectively. And I do think a lot of that can be straight exposure to very difficult, complex situations that makes it a bit easier than to navigate those situations, especially if you've got a process and approach, a way to navigate those situations.
I know at Sentio we do advanced supervisor training and deliver practice, and this is often one of the more challenging skills for supervisors to learn when doing deliver practice, is to handle the higher states of emotional activation, even from trainees, because that can happen as well in supervision, without just going to reassurance and without just going to kind of platitudes. And so there's something about the repeated exposure and rehearsal that can really build that muscle, so to speak. We have one last question here. I'm going to try to squeeze it in. Someone asked, what if someone is constantly negative and telling you in a session that they're concerned about things always ending up poorly or badly, where there is not an immediate skill to use necessarily? Are there any skills from this book that would be helpful for that?
I mean, my first thought went to validation. What makes sense about that client's belief, or that client's, the feeling that the client has that things aren't going to go well, or what makes sense about that? So validation skills, and then I would go from there. I don't know, Shelley, if you had any.
Yeah, I mean, I think any of the many of the skills in the book, I think starting with validation, and if this is a recurring theme, it may also involve highlighting a pattern, highlighting a problematic pattern in the way the person is thinking. And that's where problem solving skills come into play, and being able to highlight in a non-judgmental way maybe what somebody might be doing. And then it may be motivational skills to see if you can actually get them willing to work on shifting that recurring problem.
So
and then I was thinking, of course, that if there is an emotion that's being avoided by moving into negative, that sort of negative thought pattern of it will always go badly, informal emotional exposure, another skill that we talk about in the book, would be useful. So I think there's a lot that could be helpful.
Great. Well, we're out of time today. Thank you, Tali and Shelley, for joining us. It was great to have you here. Thank you to all our participants, especially people who participated, who offered your responses in the chat. We got some really cool feedback, very nuanced feedback from Shelley and Tali, and I hope we can do another event soon.